It wouldn't be an AHURI conference unless we had some research, some evidence to bring to the table. We've been conducting an inquiry looking at welfare reform and that process that's referred to in sort of more internationally, I guess, is individualisation. I guess the somewhat equivalent to the notion of consumer choice. And doing some work on how that applies to housing policy and housing assistance in particular. That's an inquiry that's been led by Professor Keith Jacobs out of the University of Tasmania, but we're very fortunate to have Professor Kath Hulse, who is on that inquiry team, to give us a sense today of what some of the key findings and lessons from the research they've been undertaking. So please welcome Kath to the stage.
Thanks, Ian, and it's always a pleasure to follow Mike and to see that the passion hasn't dimmed with semi-retirement, I think you called it. So I'm here, as Ian said, on behalf of the team, taking one for the team, to talk about the work that we did around consumer choice, welfare reform, and to link into that housing assistance. So, as in any research and inquiry of that type, a lot of the work's very detailed. So I'm not going to give you a lot of detail today. What I'm trying to do is to distill from all of that what are the really big picture messages to take away from the research. There's plenty of stuff that you can read if you want the detail, but what does it all mean? What's the big picture? And so what I'm looking at is the research evidence around what we might call some of the policy development options, and they're around what are the options to enhance demand in the market? What are the options around enhancing affordable supply? And they're sort of traditional ways in which we've looked at housing, but housing has been often somewhat disengaged from the human services debate, and in fact it's quite interesting that the Harper Review didn't look at housing at all. It looked at other types of human services. So how does it connect with debates around individualisation of welfare services, which are clearly very current, and some moves to individualise housing assistance, which have been somewhat separate? How do we make a connection between them? And overall, how do we move to a position where we have demand-led assistance and supply, that these things, they're two sides of the same coin if we're going to move forwards. So that's the sort of big picture terrain that I'm going to cover in my 30 minutes. So the first one is around enhancing market demand, and that is, if people can't afford to pay for housing, why don't we give them some more money to assist them? Wouldn't that solve the problem? And there are different ways in different countries of doing that. In our system, of course, we have rent assistance for private and community housing tenants, and that is giving people money. There are systems which are more like in-kind assistance. People talk about vouchers, particularly in the United States. So instead of giving the money, people are given a voucher with which to buy accommodation. And other sorts of assistance, sometimes in other systems, which might address asymmetries in information to help people to have more information for their housing search, and even quite practical assistance. There are ways around the world of giving people more practical assistance to search for accommodation. So these are all ways in which attempts have been made to address the particular issues faced by low-income and vulnerable consumers, using the terminology to compete in the housing market. Many of those models are a sort of hybrid between income support and housing. Sometimes they're really a part of the income support system, and I think that we would say in Australia that's really where we are. Other countries have systems where the housing component is more dominant, and so I've just given you some examples there of where that's the case. Because it's a hybrid between income support and housing, that sort of housing payment is inevitably affected by welfare reform. And the sort of welfare reforms that we've seen in the UK and also in Australia and other countries are around simplification of payments. Housing is a problem because it's a very big expenditure. It differs by different housing markets. It poses great problems for your income security systems to get a system that will actually effectively provide assistance with housing. So that's just a little snapshot of the ways in which different countries have tried to enhance market demand. So does it work, giving people the money or giving people a voucher? What does the research say about that? The sort of positives that came out of the research were an idea that for some people it gives them a more active role and responsibility in searching for their housing, and for some people that can work well. It can also enable people to make their own trade-offs, and I think trade-offs is the operative term. Shelley talked about choice, and it's a very sort of slippery concept in the way that we use it. We all make trade-offs. It's not a constrained world. Our decision-making is bounded. But if people can make their own trade-offs, then that might produce better results for them. It can assist in targeting assistance to need and for the duration of need. And these sort of systems can be tied to other welfare reform objectives. So an example of that is in the US, housing vouchers have often been tied to participation and employment objectives, and also moving to areas, as they describe it, of lower poverty. So these are the positives that have come out of the research. Negatives, the point that's been made this morning is that if people are vulnerable, they might not be able to negotiate access to housing. Partly it may not even be a matter of money, although it almost always is, but other factors as well, including their mobility and their ability to negotiate access. The market works in such a way as low-income people can be squeezed from job-rich areas to job-poor ones, and that's really negating the whole purpose of welfare reform and a focus on employment participation. A sort of negative from government's point of view is that, particularly if they're demand-driven, it's really hard to control expenditures, and you'll see the latest figure for rent assistance, which is $4.2 billion around Australia. So that's been growing very substantially, and it's hard to cap that given the sort of system that we have. And then more controversially, there is some evidence around the world that in some markets, not all, that those sort of housing allowances can exercise an upward pressure on rents if there's a concentration of people there. But the main point I think that's come out of it is that such an approach, the research shows, has been ineffective in increasing supply at the low end of the market, and that's very significant. So it's supply that I want to turn to next. How do you enhance affordable supply, and what's been done to do that? Well, we've seen in Australia and elsewhere the various strategies to enhance supply, and they include direct government investment, which is the traditional model that we have, part government investment to try and leverage private investment in affordable supply, and also to leverage not-for-profit investment in affordable supply. So governments have played a variety of roles, but they've all involved government. Other strategies around the world have included targeting of tax concessions to either new supply or the lower price segment. So some countries, for example, make a lot of use of depreciation allowance to try and get people to invest in new supply. Someone mentioned this morning, I think, inclusionary zoning and or developer contributions, and we've seen that as a strategy, particularly in the UK, where it's been used quite extensively to generate more affordable housing. We've seen housing loan or bond aggregator models, again using a UK example, the Housing Finance Corporation, and there's been much discussion on that, those sort of models in Australia. And other financing options such as affordable housing trust models, and there are examples in the US of social purpose real estate investment trusts. But the main issue to be addressed is that of addressing market failure. It was one of the categories I noticed this morning, and quite a lot of people said, yes, that was the issue, was market failure. how do we address market failure at the low end of the private rental market? So I thought I'd just sneak in some work for another project that I did with Margaret Reynolds and Judith Yates. And this is looking at the private rental sector. We've had a lot of discussion this morning about social and affordable housing, but the capacity to access the private rental market is really critical, either for the number of people that Mike just referred to who are on the waiting list for social housing, or those people who are currently living in the sector and who are likely to remain there. And this is just work that's been done over 4 census periods, and it's very interesting, I think, in a couple of respects. How does the private rental market work? Well, one thing you can see is that rents are very concentrated. In the last period, which was 2001, they were very heavily concentrated between $300 and $500 a week. This is Australia-wide. And then there's a bit of a tail at the end, but not a great deal. They're extremely concentrated. So there's been an increase in supply, but it's generally in that sort of bracket. The other point you'll see from these data is that in the period 2006 to 2011, there was clearly an increase in rents. And that has significant impact at the lower end of the market. When we use that research to look at figures of shortage and availability, and these provide quite compelling evidence of shortage and market failure at the bottom end of the market. These are for what we call Q1 private renters, that is people with the lowest 20% of incomes, which in 2001 was under $30,500 per annum. And what's shown there is that of the 347,000 households renting privately in that category, there were only 159,000 dwellings that they could rent at 30% of their income. And some of those were occupied by people looking for cheaper rental because they wanted to save and buy or whatever reason. So the supply was simply not there, and it was exacerbated a little bit by people on higher incomes living in that lower rent housing. It's particularly an issue around Australia. It's particularly significant in metropolitan areas, and you will see from those data that in the metropolitan areas, only 12% of those Q1 households were living in affordable housing, using that rather crude measure of affordability. In the non-metro, it was a little bit better. And this one shows the particular issue in state capitals where that shortage was. So as you will see for the figures for example, Sydney and Melbourne, the issue was about supply. It wasn't really that other people were living in low-cost stock. So in Sydney, in that year, only 8% of those Q1 households were living in affordable housing. So I think there's pretty compelling evidence of market failure at the low end of the private rental market, and that's despite what we would all recognise as a great increase in supply and investment in private rental in that period. So in 2006 to 2001, all households increased by about 9%, but the private rental sector increased by 18%. So increasing supply generally didn't do it for people at the bottom end. Particularly affects those with incomes below about $30,000 in 2011 dollars, and it's particularly acute in the areas that I mentioned. What do we know about models to enhance supply? Well, what we do know is that direct government investment did produce supply, and I put up there the figures for the Social Housing Initiative, and that was very substantial. It's also expensive, at least in the short term. I've also put up there the latest figures, well, December 2015, for the NRAS, the number of units delivered. So can that produce supply? Yes, it can produce supply at volume. Other supply strategies have been particularly difficult to advance. Either they're highly contested, that is, measures to change the tax system and tax concessions or planning, or they're complex and very slow to develop, such as new financing mechanisms. I think we're inching forward on that one, but inching forward is the right way to describe it. I recall Mike Berry and others doing work for the National Affordable Housing Consortium in 2000, which was around financing, and 16 years later we're still inching forward. But it's clear, and it was clear this morning, that some of the major social reforms that are currently being put in place, such as the NDIS, depend on a supply of housing that's affordable to low-income households. And Elan and Daphne Habibis estimated the unmet need for affordable housing for the NDIS, and you'll see that's extremely, it's a very large figure at the full rollout of the scheme in 2019. So that's supply. If we look at individualising services, well, it's clear from the discussion this morning that there have been major innovations around NDIS and consumer-directed care. I don't think I can bear to mention VET in that context. And internationally, this is part of an international wave of reform. It's not just Australia that's doing it. And we looked at, through one of our team members, Julie Lawson, various schemes, particularly in Europe, around home care and personal budgets in countries such as the Netherlands, Denmark, the UK and elsewhere. So this is a wave of reform in the way that welfare services are being delivered in a range of countries. And it's around the sort of principles that Ian Harper was outlining this morning around competition and choice, and particularly involving private providers in some of those contexts. So given all that, what does the research say about that? There is, and I've worded this very carefully, the potential for more choice and control. Actually, there's very little evidence on whether it really has delivered that in practice. Some of it's quite new, and some of it has teething problems, as you might describe it. It is good if you can get customised assistance and packages of support, and there have in some cases been a greater variety of service providers come in, both market and not-for-profit providers. And people generally, and that was reflected in this group, are not opposed to the idea. They think, you know, giving people individual packages and choice may well be a good thing. But choice is a bit like motherhood. It's very hard to be against choice. You know, no one's going to stand up and say they don't agree with it. The negatives that have come out from the research, and this is reinforcing what some people said this morning, is that there's limited capacity of some vulnerable people to make very complex care choices. And people live in a social context, so it involves not just them, but their relatives and carers, and there are dynamics around that. That some of the services that were interviewed for this are very much affected by contracted time and cost constraints, and I think that came out in the panel discussion this morning, particularly where there'd been blocked funding prior to that, and you know, it made for difficulties. There was some scepticism, certainly from service providers, about the ability of their clients to access markets and market provision. And again, the more competitive relationship between service providers, which is something that was raised in questions this morning. It's a little bit hard to tell. That's the big picture. Particularly in Europe, there's been an austerity context since the global financial crisis. So governments have been rapidly, you know, reducing expenditure on all sorts of items and considerable fiscal constraints. So that's been the environment in which these changes have been introduced. And would they work better in a different sort of environment is an interesting question. Relating that to housing assistance, and housing is has not been well connected to human services either in Australia or elsewhere. I mean, it's interesting. Housing's at the intersection. It's part of housing, part of economic policy. It's also part of social policy, but not particularly well connected to either. And as Minister Hazzard pointed out this morning, we use housing at times of economic downturn to pump prime the economy and then forget about it. And housing has not been all that well connected to major changes in social policy, but I think that era is very much at an end, and we're having to see what the connections are. In terms of housing assistance, do we individualise housing assistance? Well, there's been various moves in that direction. I think that we're sort of at least talking about two different market segments at the moment, which are social and affordable housing, in addition to the homelessness services. There is greater diversity in dwelling types. There have been some moves about the length of lease and conditions under which people occupy housing, and there are complex and controversial questions about rents, which someone raised this morning, that the price signals very much the elephant in the room, I think, and one that we found it very difficult to deal with. And also some work around housing and support packages. So it's not as much a one-size-fits-all as once it was. And there has been work around assessing individuals for a range of options, although I think it's fair to say that that's also a form of demand management to reduce demand for social housing. And as has been mentioned before, there are other systems to try and improve access, such as the choice-based lettings in social housing in the UK and the Netherlands, which works to give people the ability to make their own trade-offs. And the principle is that people are better at doing that than any well-intentioned, well-trained housing officer will ever do on their behalf. And what makes for satisfactory housing and what's important in those trade-offs is often a very individual thing. The issue of collective voice came out quite strongly in our research, and I was pleased to see that a number of people have raised that here. And that is a focus not just on individualised welfare and individualised assistance of people as users or consumers of services, but what is the role for collective voice in the design and the delivery of services. And there are some good examples of that, sadly not particularly in Australia, but from some of the examples that we looked at in the UK and the Netherlands, and there are things to be learnt from that. And the other factor which we've seen to a degree here, more in Tasmania than anywhere else, is the idea of multiple providers. That is moving away from government monopolies, and as Ian Harper said this morning, disentangling some of those issues around who provides, who funds, who regulates, who finances, that there are conflicts of interest in having that within one public monopoly, and part of that is moving towards a multi-provider system. So what does the research say about that? Improving choice, as I said, is effectively about making trade-offs explicit, and there are ways of doing that, but there are constraints. It will not work for everybody. It relies on information, skills and the capacity to be able to do it. Diversity of products. One of the things that Ian Harper talked about was innovation, and I think that it's clear that there's more innovation in the not-for-profit sector, and it's very difficult for governments to do that because of their equity issues and being seen to be treating people in the same way. And that's good, but it also works as a constraint. Collective voice for users, I've mentioned, and multiple providers is the most common model internationally. We have a very unusual model in Australia of these public monopolies. So, putting all that together, what does that mean? So the things I've talked about, and they're within the framework of these broader changes. So enhancing demand is within the framework of income support and welfare reform changes, and that's a very, very big driver. Enhancing supply is in the context of changes in tax and fiscal expenditures, planning and financing. Individualising welfare is in the context of work around support, participation, inclusion, and individualising housing assistance is around changes in provision and management, potentially financing. So what would that all mean? And I've used, to try and pull that together, a sort of distinction that's made. It was one of these ideas that came out of the Harvard Business School, that inflicted upon the world, and sort of I've loosely adapted it. And it's a distinction between sustaining innovation and disruptive innovation. So sustaining innovation is around improving outcomes for existing customers. And disruptive innovation is around creating new markets and for new types of customers. So if you look at the left-hand side of that, sustaining innovation, what could you do to enhance demand? Well, there is potential, and governments have fiddled with extending, restricting or restructuring rent assistance, for example. But not much has happened because there's a lot of zeros attached to it. And if you get it wrong, it can have major implications for the bottom line. And there's some risks associated with that. Individualising housing assistance, I think we have seen some new access models. There can be work around different packages of assistance. There is a slow move to multi-provider systems. Stock transfers is part of that. I think it's a second level issue. It's not however complex and difficult it is. It's not a first level issue. It's a second level issue. And there are supply constraints and risks for household and governments. So I think that where it's going is in the area of disruptive innovation, and that's around supply. That we do need new mechanisms for enhancing supply. The market clearly is not doing it, and we have to leverage off some of the research and development work that's been done around that. Which is around new financing mechanisms, particularly the bond aggregator model, using the planning system, however controversial that is, and some tax changes, although clearly that's politically extremely controversial and likely to be an issue in the upcoming election. But the point about that is that it has to be done at volume. You can't do it in small bits. It's not little and local. It's national and big. And particularly if you're going to get in institutional investment, the clear message from all the excellent work that's been done on that over those years since 2000 is it's got to be big and worthwhile for institutional investors. So that's in a way the opposite of being individualised. It's big. On the other hand, we've got some of these major social reforms which put the individual at the centre. And it's important to leverage off some of those reforms to be able to provide support and assistance. And some of that might be about money, but it's not the primary driver. But it could help some of the financing models to work. And I think someone mentioned earlier a gap. The gap is shrinking to the degree that interest rates are at record lows. And so, raising finance is not as difficult as it was in 2000, but there is still a gap to be fixed, and some demand support has a role in that. The challenge, as I'm sure you'll pick up, is that somehow you've got to link the big supply issues and doing things in bulk and in volume to get money into the system with the delivery of services and accommodation and support, which puts the individual at the centre. And we need to think about new mechanisms that will enable us to do that in the middle. And that's the challenge, I think, for disruptive innovation. And I'll just mention, the inquiry panel, who you'll see contains some very distinguished people, some of whom are in the room today, and the AHURI research team from 4 different universities. And so we acknowledge particularly the input of the inquiry panel. And there's lots of things you can read if you want more detail around what I'm saying. Thank you.
Thank you very much. Am I on? Thank you very much, Kath. Terrific as ever. And starting to give us, I think, some of the language and frameworks to start to sort of get some handles on this conversation, which I found very, very useful indeed. We've got 10 minutes or so to take some questions from the floor, have questions again over the app. One initially come through from Tim Bale. Why did you list greater competitive relationships between providers as a negative effect of individualised welfare services?
This is based on the research that we did, and people talked to us. Someone had a word earlier, coopetition or something.
Yes.
And really that came out very strongly in the interviews that were conducted both in Australia, and I've met 2 or 3 people here who were interviewed for one or more of the projects and overseas, is that people were concerned about balancing traditional cooperation between agencies providing different sorts of services and competition, which, as Ian Harper said this morning, I mean, the idea of competition is intended to sort of weed out those services that people may not actually want or delivered in a way that people don't want. That's exactly what it's for. From additional demand for the sort of things that people do want.
If there aren't any questions from the floor, I'll keep taking them via the app. But I mean, I think one of the points that's come out from this morning's conversation, and you made the point again today, is that we're generally pretty poor in terms of things like co-design, working with the tenants. I mean, in the UK context, whether or not a tenancy would transfer from the local government to a housing association, there was a poll of the tenants. Yeah. Well, why do you think we are so poor in that sort of area of policy and practice?
I think that I remember once sitting in a room in a state that I won't mention with a group of people working in the housing sector who explained to me very carefully that it didn't really matter what people felt or wanted because it was a captive audience and they basically get what they were given. And I was quite shocked and horrified, and even more so that others weren't shocked and horrified by that. So I think we're moving from a history which has been very top-down, monopolistic behaviour, which hasn't had a great deal of concern for the clients or customers of that system and what they think. And they've certainly moved forward a long way from what I'm describing, but I think there's still a way to go.
Do you think it's partly, I mean, some of those other European contexts, their welfare states are crudely bigger?
Yep.
I mean, is it the fact that we target very, very effectively? Do you think that's part of the explanation?
I think it's always been there. I think the attitude was there when we housed working families, and I think it's probably become more entrenched the more vulnerable the population is. And as you're aware, the inquiry panel discussed that. Are the public on side? How do they view the clients of social and affordable housing? And generally, a lot of that wasn't very positive, was the view.
Question from the floor. Thank you.
Thank you. Hi, my name's Angie Blutz. I'm from the ACT Council of Social Service. Just to build on your point there, one of the points that, as far as I understood it, of moving to this model of competition was to make services more accountable. And in terms of what you were just talking about then, I'm just wondering, is a market model that focuses on, to be a bit crude, changing the terms we use, whether they're clients or customers, actually enough? Or do we actually need institutional mechanisms that actually give those people control and influence in the actual design of services?
Well, I think that's a very good question. You can change the terminology all you like, and clearly from this morning people have agonised over it, and at the inquiry people also talked about a term that I haven't heard used today, which is around citizens, protecting the rights of citizens and giving citizens a decent life irrespective of their personal circumstances. So it's not just about changing names, which we all seem to be struggling with. It's actually about changing institutional structures. And I think that Ian Harper is right in terms of there are issues of organisational culture. I think this came out through our research very strongly as well. It's quite hard to change organisational culture once it's been established. to actually listen to the views of consumers or clients, whoever they are, and which is where his view is that market signals come in. That's the power that people have. If they don't want it, they can say no. The problem in this sort of area is that, housing, it's very difficult to say no, as has been pointed out, and once you're housed, it's very difficult to say no. As in the data that I showed you about the private rental market, you don't like that. Well, no, but what are you going to do?
There are a couple of questions that have come in here asking more again about what the consequences of the introduction of such reforms were in these other contexts. I mean, one around, is there any evidence about what impact it had upon collaboration, which was one of the sort of conversations we had this morning? Yeah. And secondly, any evidence around having an impact upon the level of subsidy or benefit, either reducing or increasing them?
Yeah. The cooperation thing came out quite strongly in the research of some of the European systems that some providers felt that something had been lost in the process, that they had systems of cooperation. And then it's quite hard to read that in the sense that, if it is a change that's disruptive, they might be uncomfortable with change, and it might take a while to bed down, I think, is important. And I've forgotten your second one.
Impact on benefits. The level of benefits. Has the subsidies gone up, gone down?
Well, the European stuff is in an environment of austerity, as I pointed out, so it's very much a reduction, and that's affected, and the providers said to us that they felt that, they were having to do more with less, basically.
So it's difficult to come to a judgment because of that broader austerity context in terms of the impact of competition?
I think it's such an important underlay to particularly the European experience that it's hard to disentangle that. Yeah.
Yeah. Okay. One of the other things that you said was that it's hard to argue against choice. It's a bit of a motherhood statement. Yeah. And then you started to argue against choice and wanted to replace it with trade-offs, which is quite courageous, I thought. Yeah. And an interesting distinction, I thought, as well. Can you, perhaps just tease that out a little bit? But you're obviously seeing a distinction between those two.
Well, choice is, and I think Shelley put this quite correctly, it's used in such a slippery sort of way and at different levels, and we've actually got to be really clear what we mean by it. As I said, nobody's really against it, but what does it actually mean in practice? And I was trying to disentangle that, the sort of motherhood stuff, from, what can people trade off? What control? It's really about control, I think, more than choice. What control do people have over their life situation so that they can work out what's most important to them?
Okay. Got time for one more question if there is one from the floor, otherwise we'll take that as the end of that session. No more? Lovely. Please join me in thanking Kath for her presentation. Thanks, Kath.